Hey guys, what's up? It's Stephen Dunn with CORE Therapy and Pilates. We're in Westlake Hills, Texas, just outside of Austin. And today I want to go over something that's very important. And it's called the 4 stages of recovery. And we're going to talk about the recovery from a physical therapy standpoint here. And what this graph is showing is 2 different things. Recovery from 0% to 100%, and the number of visits in physical therapy from 0 to 14. Now, the reason we're using 14 here is because the national average is actually 11. And 11 is right here where it gets you from phase 2 to phase 3. So 1 visit to 11 visits stops you at the phase 2 into phase 3, into phase 3. And I'm gonna explain that in just a second. And basically, the reason that people come back to therapy over and over without their problem being resolved fully is they get better in this phase 1 and 2 when they get to this area, but they don't continue the process. Because if we look at 11 up here, it's only 70%. And I don't really like getting people 70% better. I want to get people more improved than that. So with that said, at the national average of 11, and this showing 14, the 14 is just getting into phase 4. And so that's where I want to now break down each phase. So phase 1 is basically to minimize pain and inflammation. And that's in this first 6 visits or so, usually twice a week in the first couple weeks. And what that does is then allows your pain to lower. And then we get into phase 2 as the pain is less. And that's to restore mobility, flexibility, and strength. And phase 2 from a, again, average standpoint of across the whole nation is visit 7 to 11, all right? Now, again, at the end of visit 11, we're sitting at 70% improved. So if we go into phase 3 is the return to normal function, all right? Normal function and normal activity. And again, people start feeling better here. A lot of people fall off as soon as they feel better. And then a lot of people fall off here because they're feeling better and they're making, they're moving better, their mobility is better, but they're really not maybe ready to get back to tennis and ready to golf, things like that. So again, stage 3, return to normal function and activity. And then stage 4 is the program that we're so proud of here at CORE, is it's the maintenance and the prevention of injury. And for us, at stage 3 and 4 is our Pilates program. Stage 1 and 2 is our physical therapy program. And 2, we start progressing people. In phase 3, our physical therapists start progressing people into stage 4 on our Pilates equipment and with some clinical physical therapy, or some clinical Pilates, or some Pilates-based physical therapy, whatever you want to call it. But then stage 4 is really our Pilates program, where we have the ability for people to come in privately or in group sessions. So I wanted to go over that today, because again, most people get to this point here and they're 70% better. A lot of people will get to here and all of a sudden they're starting to make that 100% better, and then they're not coming back in 6 months later. So because the reality is we teach people to do a lot of things at home and how to maintain it, but people just don't do it. Life takes over, their jobs, kids, reality take over, and it's hard to keep up with the program. Whereas we're designing programs that make it easy for you to stay committed and stay moving, progressing forward to reach those goals and make those transformations. So guys, thanks for watching. Those are the 4 stages of rehab, broken down into each stage. And y'all take care, and we'll see y'all soon.